Hello and welcome, friends. You are watching Indian Bengalis in UK talk show series In Conversation with me, Arundhati. You would be glad to know that our lovely admin Dalia has very kindly agreed to host today's show with me. We will introduce our today's discussion panel in a bit. But before that, let me share a thought with you. Very often, I see trains in my dreams. And I think many of you do as well. Trains in dreams, I read, symbolizes many things, but most importantly, the journey of life. This phrase, mind the gap, as I have chosen our name, as I have chosen to name our today's episode, brings in mind the fast-paced life of London. And like most big cities in the world, everyone in London is running to get somewhere in life, to achieve something. Well, we all are. We all are. Now, you might argue that, Arundhati, you are forgetting this lockdown and how restricted our life has become. But tell me, has it really stopped us from racing? Perhaps nature intended us to? Yes. But I think we have found a way, even in the virtual medium, to resume our struggle, to get ahead of each other, to try to make a name, to gain some fame, to prove our worth in office via Zoom, struggling more than ever, won't you say? And in this process, not everyone can fall in line, you see. Some of us can derail, find some gap in our mind that needs healing. Some of us can have a gap year or two, and that's all right. That's all right. Let's deal with the problem head on, just as we do with flu or common cold. Know about the symptoms, find its cure, and move on from there. If we can deal with COVID, mental health problem, after all, is only another health problem, and it shouldn't be that big a problem, right? So before we delve deeper into these specific problems of our minds, let me introduce you to the right people who can help. Now, I would like to usher Dalia on screen. Dalia, would you please do the honors and introduce our guests?
Hello, Arundhati, and thank you. Welcome, everyone, to our show today, Mind the Gap. Today is Mental Wellness Day, and today we have two renowned psychiatrists with us and mental health activists with us in the show. Let us introduce our first guest for this afternoon, Dr. Sarkhel. So, Dr. Sarkhel, he is a consultant psychiatrist, joint founder director of Living Mind. He has over 25 years of experience in mental health services. He is currently an examiner for the Royal College of Psychiatrists. Dr. Sarkhel has got particular interest in stress-related disorders, including post-traumatic stress disorder, mood disorders, anxiety disorders, and obsessive-compulsive disorder. He has got expertise in administering drug-free intervention of depression called repetitive transcranial magnetic stimulation. So let's welcome Dr. Sarkhel.
Hello, doctor.
Hello. Thank you so much, Arundhati and Dalia, for your kind words and introduction. Really very privileged and delighted to be part of this fantastic initiative by IBUK. So thank you once again.
Let us introduce our second guest for this afternoon. He is Jayanta Roy. He is a mental health activist, founder director of Sangeet Foundation, a charity organization which is working tirelessly since 2015 in raising awareness of mental health issues, which is making music and art an integral part in mental health ailments. Its motto is happiness through music and arts. Let's welcome Jayanta.
Thank you, Dalia and Arundhati. Big privilege for me to be part of this. And thank you for taking up the cause of mental health and mental wellness. This is pandemic that we are facing, and thank you for bringing it to the fore on every table.
Thank you, Jayanta, for joining. Thank you, Arghya, for taking the time out and coming.
Pleasure.
Thank you. Let's welcome our third guest for this afternoon, Dr. Rina Dutta. She is a consultant psychiatrist and senior clinical lecturer, FRC Psych. She works at the Institute of Psychiatry, Psychology and Neurosciences, King's College London. Her major research interests are suicidal behavior and self-harm, as well as social media and mental health. She has been media trained by the Academy of Medical Sciences and was involved in the first BBC showcase of only 11 female scientists in January 2018. She frequently appears in various TV and radio channels to talk about mental health awareness. Let's welcome Dr. Dutta.
Hello,
Dr. Dutta.
Fabulous to be here, and thank you so much for this invitation from IB UK. Arundhati and Dalia, wonderful to see you today, and great to be with my colleagues Arghya and Jayanta. Thank you.
Thank you
Hello,
so
Rina.
much.
Thank you so much for coming and joining us.
My pleasure.
So let's start the program today. And please remember, this is an interactive program, so feel free to send us your questions or any comments. Our panelists will be very happy to answer them.
Yes, we would want our all of you, the viewers out there, to engage and let's talk more and more and make this taboo go away, And I will come to the first part of the show, today's event. I will come to Dr. Sarkhel. Tell me, Arghya, what are the most common types of mental problems you see in practice?
Right. So in my practice, both in NHS, while I was working, and also in private sector, is mood-related, stress-related disorders are fairly common, I would say. But although I know we are going through the pandemic situation now, but even apart from that, leaving that aside, usually the anxiety disorders, the depression, they're fairly common disorders, the mood-related disorders. Of course, we do see obsessive compulsive disorder, which is basically a special type of anxiety disorder. So I would say stress-related and the mood disorders are the commoner ones, really.
Okay, so these are all very common names, like we have already become acquainted with the terms, but
Sure.
I'm not sure, I don't understand the finer differences. It will be nice if you can, I will ask you the questions. Like, is there a difference between depression and clinical depression?
Right. So I'm glad that you asked that question because it's something is used very commonly. We are suffering from depression. Someone talked about clinical depression, and sometimes they're quite loosely held terms.
I'm feeling very depressed.
Yes. So feeling depressed is not necessarily a mental disorder or a mental illness. For example, sometimes we might have a bad day at work. We might have some problems, some kind of stress, whether financial, relationship, whatever it is. But sometimes our mind automatically reacts to that. So that's very normal expression of mind to remain in a depressed or low mood.
Okay.
But on the other hand, if we see that it's quite severe, low all the time, not getting any joy out of anything, losing interest in food, not sleeping properly, becoming a bit hopeless. So it's a combination of various symptoms that should ring really an alarm bell that we need professional help perhaps. So, and that is why we are going towards what we called depressive disorder. Sometimes people say clinical depression. Clinical depression is not really a term recognized in the classification system, but I suppose we are referring to what we call as depressive disorder. And as I said, these are the symptoms. And again, these are of different severities. So it can be very mild, where people have, or some symptoms, not all, maybe not so severe to affect their functioning, whether at work or whether in their society, somehow managing but a bit strained. So that's called mild. On the other hand, the severe end of it, probably extreme symptoms, sometimes hopelessness, severe helplessness, not getting any interest in the life. And there is something which is between mild and severe, which is called moderate. So that's how we classify our CC as psychiatrists: the mild depressive disorder, moderate depressive disorder, and severe. But as I said, it's the symptoms and also the effect on our function. That's what makes the disorder. Okay.
Right. So that is interesting. You mentioned the mild, moderate, and different stages of disorders. So at what stage you think a medical intervention is required? Like, when do I know that, like, if I'm not feeling up to something, how do I know that this is some form of mental problem I'm going through, or it's just not a laziness, it's just not my character? When do I know that?
Yes, perhaps I could start with the latter part of the the statement that you're making about the laziness, because again, sometimes it can be construed as our personality, or you can snap out of it. So it's so that is why when an assessment, whether psychologist or psychiatrist does the assessment, we make sure we try to know what's our baseline before we started feeling unwell. What was our personality? Some of us are a bit more laissez-faire than others, and that's okay. That's part of the personality. But if those symptoms become more severe, affecting our functionality, then if it's a mild stage, I wouldn't necessarily say they need medication, but there are a lot of helps available: talking therapy, counseling. Sometimes we recommend some self-help books that can be valuable. So that can be very, very, so often they're based on cognitive behavior therapy. They're extremely helpful. But moderate onwards is probably they need medication, talking therapy, combination of both. And not to forget, we talk about medication, we talk about psychological intervention, but social intervention can be equally important. And I'm so glad today, Jayanta is there from Sangeet Foundation. So I think it's very important to have a very integrated approach when we talk about the treatment of depression. So, Rina, if you want to sort of add on anything, or want to
Yes, sure.
comment on anything.
I think it definitely has to be a multi-stranded approach. It's not just a case of being able to cure necessarily with medication. We really have to think of talking therapies very carefully, work in tandem with them, and look at managing as opposed to curing, I think. Sometimes it's not possible for some individuals to completely have total cure, such that, they never have to take any form of treatment again. It's a bit like diabetes or asthma. They might need some form of maintenance. And so management, I think, is a key word here. And of course, anything you can do to bolster your mental well-being, as Jayanta will tell us about, is incredibly helpful.
And when it comes to medications, do these medications, they have any kind of side effects or anything?
Right. So obviously, any medication, whether they're for our blood pressure, diabetes, or mental health, they do have some side effects.
Mm-hmm.
And so the idea is that when we decide about what medication, there's always a balance of risks versus benefits. So yes, we explain there are common side effects, for example, antidepressants, but the benefits that you'll get most of the time, especially when you talk about moderate to severe, that will outweigh the risks or the side effects. So that's one. But secondly, interestingly, sometimes I always say that it can be side effect, but it may not be adverse effect. And I'll give an example. That, so for example, someone is not sleeping very well. So there are classes of antidepressants that can have a side effect, that excessive sleep, say for example. But for that particular patient or that particular person suffering from severe depression with insomnia or sleep problems, that is a side effect, but it's not an adverse effect, if that makes sense. So often when we talk about side effects, it has to be in the context, as long as both sort of psychiatrist and the patient or suffering from depression understand together that risks, the benefits outweigh the risks, then it's okay to take the medication, but of course they'll be monitored. So if it's a dose-dependent side effects, we'll adjust the dosage. So, and again, it's like any other physical health medication, like insulin, if you take for diabetes, it has got side effects. But the reason we have to take it, because long-term benefits will clearly outweigh the risks. One more thing I want to just highlight, there is a lot of myth in the public that they're all addictive. Once you go on it, you can never come out of it. If I can just bust that myth completely, none of the antidepressants are addictive. Yes, when we come off it, we might have some withdrawal symptoms that can be managed, but they are not addictive. So, you know, they do not have that quality. So I thought I'll just, because the community event for the viewers and listeners is important for them to know that they are not addictive.
Yeah, that was good to know, actually.
I have to, I will share some of the comments that our viewers are asking. Tapu Das says, thank you for bringing this painful topic to make people aware. Shubhayu Roy asking, Dr. Sarkhel, we go through almost spontaneous waves of ups and downs in life. At what point you call it a depression? Would you like to answer to that, Dr. Sarkhel?
Yes. So I think as we touched on that we need to see at that point of time, whether the ups or downs, particularly downs in terms of depression, what are the symptoms, how it's affected, how persistent they are. But the most important fact is how it's affecting our functioning. That will determine not only the diagnosis, but also the management plan. So yes, it can be depression, but not a spontaneous waves just up and down, which do not last for longer than, say, you know, a day or two or for a few hours. That is not a depressive disorder as such. It can be depressed mood lasting for much shorter period.
Here, one question that is coming, it's popping in my head is, you were talking about diabetes and other ailments. Is it true that some of the disease in themselves, or these are the hormonal deficiencies like diabetes or thyroid problem, they can bring secondary depression, and if that happens, there is actually depression is inevitable then? Is it so?
It's an interesting question, because this is a subject of what we call liaison psychiatry, means that psychiatric disorders in people suffering from medical problems. So when we talk about the interplay between physical illness and psychiatric disorder or mental health problems, it can be explained in three different ways. So the first would be that, yes, having to manage a long-term chronic condition, that itself could have a psychological effect on the mood, because you think about some of the disabilities, not being able to carry out some of the functioning, which otherwise people would have been able to carry out. So that's one aspect. Second aspect, interestingly, some of the medications that are used for physical health, that can have side effect of depression. So it is important, if someone is having at least moderate to severe depression or other symptoms and suffering from physical health problems, should have a joined up approach between the physician and the psychiatrist to talk to each other. And the third thing, of course, there'll be some common biological underpinnings which might explain both the psychiatric disorders or the mental health problems as well as the physical health. So Rina, I don't know if you want to comment on anything that...
I do have one more question for if Rina, if Dr. Rina Dutta would kindly reply to this. Depressive disorder is likely to affect more to older people, Shamarjit Roy is asking. Is it true that it can affect more for older people?
I think the point to remember is that it can affect every age group in life, and the how it shows itself is different in different age groupings. So, for example, I'm particularly interested in young people and children adolescents, teenagers, and it can manifest really differently there. It can manifest in inability to concentrate, lots of problems sleeping, just being unable to really motivate oneself to get to school, etc., and perhaps withdrawing from the family. In older people who haven't suffered with depression all their younger life, it tends to be more reactive. So it could be reactive, for example, to bereavement. If someone's long-term partner of 40, 50 years and they're suddenly left without that person, this could be a complete tragedy for the individual. So, those sorts of reasons, plus comorbid illnesses. So, for example, there's a whole branch of psychiatry that specialises in cancer care psychiatry and palliative care as well. So, there's all the different life stages are prone to depression, but for different reasons. And obviously, older people are vulnerable, yes.
Yeah, while we're on this topic, I'd like to ask this question. So, is it true that some particular industry tends to be more affected by this mental health problems? Like, for example, the entertainment industry or performing arts industry? Or is it just that we get the news out of them? I mean, I'm asking this based on the recent events happened in Bollywood, not going exactly into Bollywood, but just do you think industry has any role to play here?
I suppose, yes. I mean, obviously, this is very, very topical discussion, and the research really does not show any particular link to that. One profession is high risk of depression than the other. However, there are some researchers looking into, say, for example, the extremes. For example, when you talk about self-harm or suicide, then it does depend on the access to the means. So say, for example, that someone has very easy access to alcohol, or, for example, easy access to anesthetic agents, say, for example. So there are some studies showing that some kind of link, but depression on its own is a disorder, not really particularly more linked to one profession than the other. But you're quite right that obviously because of entertainment industry, it's a very different, because their ups and downs, the difference is quite big. So when they are in their prime time, it's fantastic. Unfortunately, when things are not quite so well, for example, even now, what I'm hearing about the musicians, about people who do the shows, their financial struggle, not just the financial, but not having so much exposure. So psychologically, that can have a huge effect.
Yeah.
So yes, we can relate that to the entertainment industry in that aspect, but just by the fact that they're in the entertainment industry, that does not necessarily increase the risk of depression compared to any other profession.
I think, though, as well, that there is...
I'm sorry, Rina, I'm sorry.
No, I was just going to add to that, that I think that there is, though, a link between creativity and a particular form of depression called bipolar affective disorder, which lay public probably know as manic depression. And so because people are really creative, for example, comedians or artists or people that commentate, they can be particularly prone to it, and it could be a genetic, more familial risk there.
Wow, we are getting more terminologies. What are these? Anxiety disorder, panic attack, obsessive compulsive disorder, and now you are talking about bipolar disorder. Will it be possible for you or Arghya to just put in layman's words? What are these in short? Is it possible?
Okay, so I'll start with bipolar, as Rina touched on that. So the bipolar affective disorder, when we talked about the depression, we only talked about almost one phase of mood, so always low. So if you think about a stable mood, and that mood is remaining low all the time. Whereas in bipolar, yes, we can have depressed phase, but at some point our mood might be elated, a bit higher than the stable mood. So you can see a bit of an undulation. You can have a stable mood for some time, then there's a manic, what we call elevated mood, elated mood, lots of energy, huge urge to spend lots of money, dizzy bit at times, not sleeping very well. So those are the signs of what you call mania or hypomania. So if someone has got a history of going through these episodes of depression, and mania or hypomania at some point, that is called bipolar affective disorder, what used to be commonly known as manic depressive illness in the past.
Okay.
And their treatment is slightly different because they're treated by what we call mood stabilizers. But the good thing is, there are many, as you said, Rina pointed out, very, very talented people who are on media as well, performing very well when they're stable. So it's not that having mental illness doesn't make us necessarily disabled. I think that's a big message to the community that, it should not be stigmatized. So that's the bipolar. And the other two that you just talked about is panic disorder and OCD.
Yes.
Now, as I said, there are two different kinds of anxiety disorder.
Okay.
So I'll come to the OCD first. OCD, as it stands for obsessive compulsive disorder, which means it has got two components. One is called obsession, which necessarily, we often use the term in English anyway, we're obsessed about things.
Yes.
But essentially what it means is the repetitive, intrusive thoughts about something in particular. We know it is not rational. We try to get rid of it, but our brain just doesn't help. You can't get rid of it. And that brings the distress and the anxiety.
Okay.
And because of that, then we are driven towards performing certain rituals, for example, washing hands many more times than is needed socially. For example, checking the switches maybe many times more than is needed or required. So you can see there are two components to it. But the good news is it is manageable with the right therapy, the treatment, the talking therapy, and the medication. So again, help is available. So that's what the OCD is.
Arghya, I would have to pause you just a little bit here because, as you know, we have asked that if anybody wants to stay anonymous and can inbox us with their queries. I have a friend, she doesn't want to be named, but she is going through some problem. I think this might be contextual to what you just said. So I would like to pop the question if I may. She is saying, she asked me to share this here with you, that she is facing some problem with her husband, especially during this lockdown. Her husband is in a very high stressed job, and he thinks like that if he wears a particular shirt that is lucky for him, or that has been proved to be lucky for him, he keeps on wearing them days like at a stretch for 8-10 days, or he keeps on turning light switch on off to check whether how his luck is on that day. He does several other things, like she was just narrating that he opens and closes the toilet door. But what is her problem is, she is trying repeatedly to make her husband show reason, to make her husband understand that this is not going to help, to make him rational, but she is failing, and that is where her frustration is coming in. So would you please explain, is it how she should handle this problem?
Right. Yeah, I'm just being aware that being in the media, so I'm not trying to comment specifically on a particular case, but given that, the problems that we're talking about, sometimes it takes time to ask for help. It is not uncommon. And sometimes it's a matter of time being reassuring. Of course, there's a difficulty and it slows down our functioning. So that's the downside, if you like. So it affects our functioning. So I think it's important to perhaps having some discussion, allowing a bit more time where people don't feel judged necessarily. It's not their fault. It's a part of the difficulty, some chemical imbalance in the brain, and allowing them to accept it as an illness and then perhaps going for help. So yes, it's not easy. Sometimes it can, for some of us, it's easy to ask for help within days or weeks. Sometimes it can take months. So there isn't an easy answer to it, but I do think sorry, my screen went for a minute, but it's important for a few things not to be judgmental, at the same time being supportive and allowing time to ask for help. Asking for mental health help is not easy for all of us. It can take time.
her husband should seek professional mental help.
Yes, I think it is important to at least, if not anything, at least to go to the GP first to talk about it, and maybe GP would be able to help them navigating whether it's a talking therapy, depending on the severity, or any psychiatrist assessment. Sometimes it's a combination of both, but that's a
Okay.
good starting point.
Okay. All right. It is a brilliant panel. Indrani Bhattacharya is saying. Thank you, Indrani, and please keep watching. But in our panel, I can see Jayanta is not talking much yet.
Well, we do have the specialist talking, so
No, I'm sure next one is coming off for John.
No, definitely. As Dr. Dutta and Dr. Sarkhel already said, that medicine is one aspect of treating mental illnesses, but there are other means as well. Like apart from medicine, there are like music, traveling, maybe doing something different, like which you want to do, something like that. So,
Bungee jumping.
sorry.
Bungee jumping.
Yeah, bungee. I mean, why not? Like any kind of experience. Like I personally, I feel travel is a great therapy. Like we go to new places, experience something new. I'm sure there are like other means, and you and your Sangeet Foundation, you are doing fantastic job. Promoting music and art and how they help in mental illness. So you want to tell us something about it? I mean, what kind of music or what kind of art do you think helps?
absolutely. So basically, there are a couple of things before we start on that journey. I think what both the good doctors also mentioned. Firstly, it is all about awareness. So it is about awareness about ourselves, that we understand that we have these feelings. So, for example, like I say, Sunday evening, yeah, I get this feeling where I feel down, where I feel depressed, right? And obviously because Monday morning I have to go to work.
Yeah, of course. I
I
think a
hope
lot of people feel that way.
I hope my bosses and my colleagues are not hearing this. Listening to this. So yeah, so I generally feel that, and that of course goes away on Monday, but then sometimes it sustains, and I get this. So I am very confused about what I feel, and I feel, am I being a bad person? Am I being lazy? You see, and sometimes I become very, very confused. What I do is, I would just take my guitar, sit down with it, sing a few songs to myself, and it does help me alleviate that situation. Sometimes what happens is I go into a cocoon, and I would just go into the sofa, go fall asleep in front of the TV, and sometimes it does help me, but sometimes when I wake up again, I come back with a very bad feeling. I think that awareness is very important, and after going through this process, I've learned that I need to be a bit kinder to myself to begin with. As we
Yeah.
say, charity begins at home. We need to start with ourselves first. So we need to understand ourselves and the immediate family around us. Now, coming to your point to say, so what can help? Now, it depends on what kind of mental health issue you have. So I'll draw physical health equivalent. So if you have diabetes, or you have blood pressure, or you have cancer, the solution is not the same. You
No.
see, the drugs, so some of the cases yoga will help. For cancer, yoga will not help. Not to that extent, at least. So we need to understand firstly what is the problem. That is one. But having said that, in general, what happens is, it's about taking your mind off that particular problem, and you focus on something that you love doing. Go back to a childhood memories. Go back to a good place, a happy place where you have been, and be there, stay there. Some things you love to do, music, arts. I focus on music and the arts, but some people focus on travel, like you said,
Yeah.
you see. And it's a happy place to be in. But then again, for some people, they are very anxious about traveling. For example,
Yeah.
I feel a bit anxious about traveling. Yes, it's very happy, I'm going to go somewhere, and I'm going to take lots of pictures, put it on Facebook. People will say, wow, fantastic. But I feel that anxiousness to say, I've got to travel, I've got to get the tickets. Will I miss the flight? Will I get the taxi? Will I get... So there's that anxiety which builds in me as well, you see. But I'm saying that it's different courses for different horses, as they say. But music and the arts in general, it does help, even though, like Rina said, about creative people having a problem. You see, they go through the problem. And Pandit Bikram Ghosh, he came to one of the programs and he was asked this question: does music help? He says, music does not help on its own. It is how you use music to help yourself. You see, and that is where you help that to help you with mindfulness, as you know, Orgo will be able to help about that. And it helps you to digress your mind. So when the pandemic happened, when there was a lockdown, so on Sangeet Foundation platform, there were lots of people who were, posting a lot of music, art, and so on. And they were not, a lot of it was not the best in class. And people said, well, the submissions which you have, it's not of good, great quality. And I'm saying, you know what? That's not the point. The point here is to be able to provide a platform to people where they can, there's a certain amount of certainty that I'm going to sing a song, record a song, post a song. It's going to be on Sangeet Foundation. Tomorrow I'm going to go and see it. That's one side of the story. The other is there are people who have come back and said, you know what? I wait for for what new is being posted in Sangeet Foundation. What is the new piece of art, the songs that are posted? And it helps them, take them out of their mood. So, the depression that they go through because of the pandemic, it's helped them from that perspective. So yes, there are other mechanisms, but we need to recognize that there are limitations to that, and that it is a medical problem. And you have our two good psychiatrists with us here. We have the doctors who are available. If not, at least go to your GP. Yeah, that it is a medical problem. So it's like having diabetes. Yes, you can go on food control, this, that, and the other, but the doctor's advice is primary. If it requires medication, food control is there, but medication is a must. That's it.
Yeah.
Right. I have missed out something. And as you were talking about music and also relaxing in your couch, I can't help but think relaxing in my couch, watching Iron Man is the best way, my happy place. And did you know Iron Man, I think we all know Iron Man goes through panic attacks on and off. Even Iron Man gets that, see?
Fabulous, yeah.
Arghya, would you talk about panic attack now? I think
yes. And I suppose, that's one of the, as you know, that the statistic says 1 in 4 in UK can have mental health problems. So if you now think about it, we are 5 of us here. Just give an example. So is Iron Man doesn't make them immune to mental illness. So when it comes to panic attacks, this is a particular form of anxiety disorder where what happens is an acute episodes of anxiety symptoms like palpitation, short of breath, sweating, shaking, and it's like a crescendo. Within few minutes, you almost go to the top of the symptoms. It's almost very crippling. The fear of, it's almost like a fear of totally out of control, urge of going to the loo, don't know what to do, shallow breathing. So it's very, very uncomfortable situation. Anyone who has experienced panic attack even once in their life, they would know exactly what I'm talking about. Now, if that happens as a one-off, maybe yes, go to someone, GP or someone, family member who has experience. There are some techniques we say, for example, breathing in a bag and things. But if it happens repeatedly, and exactly same criteria, that it starts affecting your functioning too many times in a day, sometimes few times, or in a week, then it becomes a disorder on its own. It's known as panic disorder. But sometimes people have other disorder, for example, depression, but can have some panic attacks. So panic attacks is a very intense, acute anxiety episode, which does not last for more than 20-25 minutes maybe, but it feels like it is for hours. It's extremely disabling condition, but the good news is talking therapy is extremely effective, particularly cognitive behavior therapy. And if needed, sometimes medication can be of assistance. So that's in a nutshell. It's a big topic, but just wanted to let you know that actually it is a manageable condition. So if anyone is suffering from that, please ask for help. It's perfectly manageable condition.
But Dr. Sarkhel, Argo, there's a question I had in my mind, and I know probably not my forum, but I'm still asking this question.
No.
So
Please do.
Yeah. So what I did realize is that, when, and I have a problem I had this issue at home where we were dealing with my daughter as well. And, what she did say was, when you go through talking therapies and the counselors, it also depends a lot on the quality of counselors, because when she got a counselor in the beginning, and she said, it just went worse. It went from bad to worse. But then subsequently, she struggled a lot. A couple of years, she got a counselor assigned by the council, the local Bracknell council. And she was brilliant. And she loved her to bits. Even now, they are in touch. And she said, what? That those 7-8 weeks really also helped her turn around, apart from music and drumming lessons that she went through. So that person dependence, would you have anything to say about the person dependence?
Obviously, when we talk about therapy or talking therapy, is the human interaction. It is different from prescribing a medication. You take it every day, once or twice daily. So it's the personality, the approach from both sides, not just from therapists, but also from the persons who are suffering. And sometimes it does not gel. If it does not gel, I always say being transparent about it to see what is it that is preventing from having forming a therapeutic relationship. So that's number one. But the other side of it as well, apart from the therapist approach, sometimes, especially when we are talking about what are deep-rooted matters, for example, trauma, etc., sometimes that is the first time it's like opening a can of worms. So sometimes I always talk about and reassure that it is not uncommon that things can get worse before they start better. So it's important also to bear that in mind as well. But yes, as I said, it finally boils down to human interaction, and maybe there are various causes. But if this is something bothering the person who is suffering from it, is important to speak out loud in the beginning rather than waiting for many more sessions only to realize it's not helping us. Just like if any medication is not helping, it's important to have the communication with the doctor. And it's not disrespecting anyone, it's just a feedback. That's how I see it. We shouldn't take it personally. If it's not something working, one form of intervention, can we revisit it? So, Rina, do you want to add anything here?
Yeah, I think what you've said about the chemistry between two individuals is key. Having that therapeutic bond and being able to align one's expectations with that of the therapist are really key. So having open conversations help. And also I do the same. I advise my patients that if you really find that, therapy, you've got to give it a chance. But if you can't come to that, then it may be better to change psychologist or psychotherapist, for example.
Yeah.
Here, Tapu Das is saying, getting help for depressive disorders can be very difficult in the NHS. Waiting list can be very long. What do we have to say on that?
Right. Okay, I'll start and then maybe I can help. Or do you want to take on that?
I have put you in a spot, haven't I?
Okay, I can take this, that's fine. Waiting lists for all mental health problems are very long in the NHS to get to the next step of care. But I would advise anyone who's having issues to seek help early via their GP. And there is something called Improving Access to Psychological Therapies. It's a long name, it's IAPT, and this is NHS-wide. And GPs can all refer into this. And some of them also have GP-based practice counsellors. GPs are able to start first-line treatment, and if you feel that you need more specialist care, it's really important to emphasise that and go through the reasons with your GP. GPs are very pressed for time, so it's worth having a little sheet of paper with some points written down about what the main problems that you're facing are, and then get them to do that referral early and take it from there. I'm afraid services are very stretched at the moment. That is very true, but we're trying our hardest to be able to serve everyone.
Yes, and I completely echo with what Rina said. And I suppose the other thing is not to miss out some of the great opportunities. For example, like say, the Mind, a big charity. Even they are offering quite a lot of free help. They do have a means testing approach in terms of ability to provide the counseling and things. Some of them can't, but the IAPT is a very, very good source. That's the psychological service delivered at primary care, where they don't need to go through the psychiatrist in order to access the care. But I suppose it's the it's a demand and what's available resources. The big sort of gap between that. So, and I think we are sort of filling that, but I'm sure system is doing their very best to cope with that, and that is why using all the other service non-NHS as well, which are not necessarily private. I'm talking about the charitable service. For example, Sangeet Foundation is doing, who knows, in the future might be offering some platforms, helping bridging the gap, if you like. So looking out for those. Some of the online therapies is available as well. And again, I'm not saying that no, that's not the alternative, but only I'm talking about what's available, making best use of that.
And not everybody reacts comfortably to in-person interactions. It's been found for some people that online therapy and online help can be really helpful. So charities like Big White Wall, which is a way of accessing support online, can be really helpful. And I'd also say Young Minds are brilliant. They have a helpline number for parents that can contact if they're worried about their young person under the age of 25 being having a mental health issue. And also, of course, the Samaritans are well known to be called 24 hours a day, 365 days a year. So we have some fantastic sources of support as well.
I have a twofold question here. First is, if NHS or if help is not very easily available, or if somebody thinks that help isn't very easily available, do you think it's a good idea to talk with friends about it when feeling emotionally vulnerable, or when one is probably thinking that maybe I need help, I need professional help, but it isn't available? Shall I talk with my friend instead? Is it a good idea?
Yes, I mean, so short answer to that is yes, but I think it's important to find out where they are normally able to confide in, having that trusting relationship. And I always say that sharing is having the problem, but it's very important also to make sure where you are sharing, because who knows what sort of problems we are all carrying inside. So, we just want to make sure that someone else we are sharing with, they're also not too unwell at the same time. And I think, but in general, in terms of principle, sharing, communicating with the family member or a friend, not only will help reducing their burden or having the problem, but secondly, it will probably build the communication much more better, in a sense, much more effective. Because sometimes, even for a family member, we don't know what to do. We don't know what's the right thing. So imagine if someone opens up, it becomes much easier, a bit lighter for the family members then to connect, because at least then, first hurdle is over. So I think it's a very, very positive thing, but just one word of caution, making sure that just by communicating or pouring out our stuff, not just affecting others. It's a fine balance, but most of us would probably have some inkling towards it. We would know if that is the case.
We got a comment here, like from Devi Porna. She is asking what kind of family and friends of those who are experiencing these symptoms can do to help.
Yes.
What should they look out for? What kind of behavioral or patterns they should look out for?
But
I think also how can we ask, and how can we suggest to our family and friends politely, without hurting their egos, or sensitively, that you might need help, why don't you go to a doctor? How to say this nicely?
I think before you can get into that, the family and friends, so awareness is important, right? So for example, um, when my daughter came and said that she had a problem with ADHD, diagnosed with adult ADHD, and so on and so forth, my first reaction was denial. This doesn't happen in our house. It's all a Western concept, right? So she
Yeah.
was studying in Oxford. She's doing well in her studies. She should actually go ahead and graduate and get a good job. It doesn't happen in our house. So that's the kind of denial you get. So when you get that kind of pushback, that can have adverse effect, you see, which is why the family member that you're opening up to needs to be brought up to speed, saying that what is it all about? And once the family member is aware, that is where the family member, the I think the family member, firstly, the family member is not a doctor. He doesn't understand. He or she doesn't understand. Right? They can only say, there's a problem. What do we do? Firstly, it's about unconditional support to say, yes, I understand. Because I know of situations where fathers have told, their children to not to go to a psychiatrist because they said, and there's a person who did talk about it. And I said, the father said, are you really mad? Why would you need to go to a psychiatrist? And the question is not that, you see. And that's what I'm saying, that when you open up to a friend, where the person has to be non-judgmental, like what Arghya had said earlier. You cannot be judgmental. If you are, that opening up does not help. You will never be able to help, because if you are judgmental with a person, you'll always feel that it is that person's fault that it is like that.
Yeah.
Yes,
So
it happens.
what exactly should be the role of the parents or partners? We have a question again from our viewers. Rini Bhattacharya is asking, what can you please throw some light on carers or parents or partners' role while dealing with mentally depressed people? What the role should be? What should they do?
I think the key
So,
thing here is trust. I think it is finding, as Jayanta is rightly alluding to, the person that the one who is seeking help trusts in is the one who needs to be able to listen. That's what we teach first and foremost. And even in sort of suicide first aid and prevention strategies, the key thing is just being able to listen with open ears and not come in too quickly. And sometimes that's enough, giving someone a space to be able to open up and listening, let it unfold how it needs to. And then very gradually getting the trust to be able to seek the outside support. And that can take time. I've just recently been helping a family to get the appropriate support for their daughter. And it's really quite a journey sometimes to actually be in that situation where the person realizes that they actually need professional support, and for the family also to realize that. And I think particularly in an Asian community, although also in Western families too, this can be an issue because it can be quite a taboo area, and it's considered as though this is something that only happens with some sort of moral defect or weakness. And I think it's really important that we dispel that, which is why I'm glad we're discussing this on World Mental Health Day.
Yeah. Like we have another question from Roop Ghosh Roy. She's saying, as Arundhati said, and you also just mentioned, Rina, that it's a taboo topic. And she's asking a question like, have you seen patients who have been battling depression or any other mental disorder for years, but came to at a very later stage?
Yes.
Does that help if somebody comes in a very early stages, or
It definitely helps if someone can come early, but please don't be put off if you feel as though this has been going on chronically for a long time. I often, in my work, I deal with healthcare professionals who themselves have depression. You'll be surprised that many doctors, just as Arghya told us, there's 1 in 4, 1 in 5 people who have a mental health at any one time in the population. So many doctors, nurses, psychologists, social workers, all people working for our health have mental health issues. And some of them, because it's so taboo to seek help, it's like, physician, you should heal yourself, or doctor, you should be immune to these things. They actually have suffered the longest and have remained very, very fearful. Maybe they've got a bit of advice from a colleague, or they've taken a bit of advice from their GP, but they haven't actually taken specialist support. Even then, we can offer help, no matter how protracted it has been. So I always urge people, do seek the help. It doesn't matter. We're not going to judge that you didn't come earlier to us. And in fact, I feel very rewarded when I treat people who are known as treatment-resistant depression, where it's quite difficult to treat.
Yes, yes. I think we have the next question on this line. Like, how do you treat people when they don't want to talk? Like Tapu Das is asking, I'd say when people are in depressive state, they don't want to interact with anyone. So how do you deal with that?
This is also my question. Yes. That
Right.
Jayanta earlier was talking about music, and also I remember Dalia, one day you were talking about whether religion does help us or meditation helps us. I also think that when somebody is depressed, he or she might not feel might not have the patience in her or him to connect to God, or to these kind of things. We can be very, very distracted then. How to do this?
Yeah.
How to
So if I
handle
can
this?
come to the first question that is also on the screen about what Dalia just said, that yes, with especially moderate or severe depression, we don't want to interact. Now, often we have clinics where I've seen patients, there's hardly any discussion, but the fact that the patient came and engaged in the treatment process and doing that repeatedly slowly opens up that channel, and maybe started taking the medication to get that bit of motivation, having that energy. So those symptoms might sometimes improve. And that is one of the reasons sometimes we do not recommend talking therapy necessarily in the beginning of treating a very severe depression, because you wouldn't be able to concentrate, you wouldn't be able to make much out of it really. Because our thinking will be very biased with a lot of negative style thinking, if you like. Seeing the whole world around us, including ourselves and the treatment, in a very hopeless manner.
Yes.
But depression is a manageable condition. So with the medications, even with the treatment resistant, there are certain approaches we can take to make some improvement in the symptoms. And once those symptoms improve, like energy, motivation, then they will start making some connections with their society, not just with the doctor, but also with their families and friends. So yes, there are different approaches that can be taken. So, one shouldn't really give up hope.
Right.
And the second question was about the religion.
Yes.
Yes,
Yeah. So
similar.
Right.
Like if I am not having the patience to talk to God, I will not even have the mental ability to talk with another friend also on this. Yes, I
Yes.
think I have got your reply. I think it is best to take medicine first and settle down a little bit, and then we go from there.
Yeah, especially in the severe end of the depression. But in terms of the religion, it really doesn't matter what religion, but the idea is having that spiritual belief
yes,
in
I
certain
think that is
framework.
it. Yeah. It's
Certain
like
framework.
there is
Yeah,
some supreme power which are watching over us. They will make everything all right, whatever phase we are going through. That kind of feeling. Is it
yeah,
also
and
the same?
essentially, yes. And as I said, that we may not be able to interact with others, but we're happy to interact with that anchor in the belief system. So that
Yeah.
is the
Yeah.
communication. And so that is why we do see sometimes having some religious beliefs or spiritual beliefs
Helps.
sometimes can help. Particularly, we do know, I'm sure, Rina will, touch on that about when it comes to suicide or self-harm. We do know that it does reduce the risk of suicide to a degree. So that is one of the protective factors. So, Rina, I know you probably have, done more research on self-harm and that side of things.
Yes, absolutely. It can be one area, but I think other areas can be simpler things like actually having pets at home. Sometimes if someone is feeling acutely as though they don't want to wake up anymore, as though they don't want to continue with their life, having pets that would not have a home to go to, thinking about children and the immediate family and how they would react. These are all also sort of protective factors to have as well.
Yeah.
And some people don't actually have religious beliefs. They can be, quite scientific in their approach, and they can also find a way through this. It's not essential to have that.
Right.
Bonnie is asking, Jayanta, the music therapy helps me too. Mood seems to confuse us. What type of music, apart from meditation and God, music helps also? A lot of people we know. What type of music, Jayanta, would you recommend?
So the type of music, it varies from person to person, right? Like, firstly, when you talk about prayers, meditation, the hymns, when you go through a person who is religious or a person who believes in God or communicates with God, being spiritual, actually, the hymns are designed, and it's across religions. It's not about a particular religion. The hymns are designed to impact your mind, to provide calmness to your mind, right? So that is one. It also matters how you have grown up. So, for example, there was an article in BBC about people who had dementia, and so they said, when they listen to their songs which they had grown up with, they actually respond to it much better, right? So that is there. Then it depends on the mood that you are in. So there are certain moods where you want to be calm, where you use calm music, whereas some people, they use a louder version of the music. So, for example, my daughter, she would put her earphones in, and you can make out go dick chicka dick chicka dick chicka. And I'm wondering, she's being an absolute antisocial. She don't listen to anybody. But what I did realize, that she was trying to cut out the outside world noise as she perceived it. So that is what it helped her keep her thinking process, her balance in there. So it's not a particular kind of, it depends on what kind of music a person would like to listen to, and it varies from person to person, their liking, their background, their upbringing, how they have the whole process in terms of where they are in their mental state. That also defines. So I think it's a deep topic, and there are quite a few research papers on this, and that's what we in Sangeet Foundation also want to do, that research with the universities and see what really is. And going back to your question, so I probably have not answered your question. I've probably more confused you with my answer, but then that's a fantastic question, and if we can crack that, I think a lot of these early interventions we can deal with these little therapies.
Yeah,
You have got. I'm sorry.
No. I wanted to request Jayanta that can we hear something from you before we move on to our next more serious segment?
You got me at dik tika dik tika.
Yeah. Can we hear something, Jayanta? I think our viewers will love that. Any piece from you?
So I'll try a Bangla song.
Yeah, sure.
Which I've picked up, and it was something which Arundhati suggested, and it was not.
I did request you on that day. I know which one you're talking about. Yes.
So let me give it a go. La 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 la. Olo chinno bina badolo tinsare ore nao shur gao jibone joyogan. Olo chinno bina badolo tinsare ore nao shur gao jibone joyogan. Agami dine rano chukhe meke dao জাগো নতুন প্রাণে ভরে নাও সুর গাও জীবনের জয়গান বলো ছিন্ন বিধান la 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 যতই বড় রাত্রি কালো জানবে ততই কাছে ভোরের আলো যতই বড় রাত্রি কালো জানবে ততই কাছে ভোরের আলো যদি একলা পথে কোনো সাথী না মেলে যদি সারা নাহি পাও সারা দেবে তবগান কোনো ছিন্ন বিনা জাগো নতুন প্রাণে ভরে নাও সুর গাও জীবনেরই জয়গান কোনো ছিন্ন বিনা কোনো ছিন্ন বিনা কোনো ছিন্ন বিনা
Thank you so much, Jayanta. That was wonderful.
Brilliant.
It really
So
uplifts.
I selected this song because, like you said, this talks about the light which is at the end of the tunnel. So beyond the darkness of the night, there we will have light on the other side of the night.
Yeah.
Thank you so much for keeping my request on this.
You're welcome.
Let's touch base on a little heavier topic now. Maybe we can dare, as we are feeling a little bit more refreshed after this song, because these are really a sad topic, really, and it makes one sad while talking continuously. But you can't avoid, as they are so true, so real. I would like Rina to talk about a little bit on, as Rina, you are working extensively on suicide prevention, and please tell us about what prompts suicidal behavior or self-harm. What are the signs that a parent or a partner should look out to prevent? So it doesn't so happen that out of the blue, near and dear one has decided and has succeeded in ending their life, and the near and dear ones didn't have any clue on this. What are the signs to look out for, Rina?
Absolutely. It's a really heart-rending subject that I deal with it a lot, and I think it's just so important. Sometimes it can happen absolutely what can seem out of the blue, but when you look back and when families sort of reflect on what had happened, they actually think that rather than the person saying to them that something was wrong, their behaviours were a bit different. So we can learn from that in some way. So if a person begins to behave unusually, so becomes very withdrawn, is not, perhaps they used to be on social media a lot, but now they've just taken to being off of it, or not posting or anything like this, or if a family member notices they're not taking meals with the rest of the family, or they are becoming more secretive about what they're doing at different times, these behavioural changes can all be indicative of a change in sort of mood and what's going on. Big indicators are when someone, perhaps particularly an older person or an adult, starts putting their affairs in order, so starts giving away, important sentimental gifts to people, or starts writing wills, or begins to make arrangements for what would happen, and sort of almost begins to start saying things which kind of ring true of someone who doesn't expect to be living for a lot longer. And of course, these are very worrying signs, and it's important to remember that asking about these thoughts of not wishing to live anymore does not make anyone more likely to attempt suicide. So speaking openly about suicidal thinking is absolutely fine, as long as we don't go into great detail with methods, etc. I think finding out just how severe someone's mental health issues are is really quite important, quite significant. So asking about that and finding out how likely they are to do something is really key.
Yeah, but how do you define, like, if somebody is having suicidal thoughts, or sometimes a normal person can get like very, very angry and do something, just the heat of the moment, he either harm somebody else or harm himself. How do you define that kind of behavior, like, which can be very spontaneous and maybe one off, and like during a very short burst of time, but
We did come across the tragic news very recently. Only 2 days back, we came across this very tragic news, isn't it? Somewhere in London, I think. Family,
yeah. Yes, so
family of three, their life ended very
yeah,
sadly.
Yeah, so obviously I won't comment on any particular case, but these
yeah.
impulsive cases which happen very spontaneously when someone is in a state of rage or in a state of incredible irritability or dissonance with kind of what's going on around them, can be extremely tragic. Very, very difficult to know how to help in those cases, because some of those individuals are not ones that have previously had a mental health problem. Many individuals that do end their life by suicide have been seen by someone like Arghya or myself or a GP, particularly in the last year of their life. But there are individuals that completely, as you say, out of the blue, this does happen to. And unfortunately, there is no way really to intervene in those cases, because it's it's beyond health services control in that case. But I would say to anyone in the general public that it's really important to be alert to any behaviour changes that are happening. A lot of students have gone away to campuses recently, and we know with lockdown that's causing a lot of pressure on them, particularly if they have to go into a period of isolation. So I think it's important for parents to be in communication, for example, finding out what's going on, because we know that the student population can be at particular risk. And I think also for even younger young people, being aware of what's going on social media as well, because cyberbullying is a big factor sometimes in certain cases, and also passive sort of peer pressure that happens. These are all quite insidious things. So parents actually being involved and knowing what's going on social media can be really helpful.
Yeah. So what sort of signs you think parents or like partners or family members should look out for? Like, what kind of behaviors?
Well, as I mentioned before, they would be looking for just changes overall in their loved ones. So if they, for example, have started to isolate themselves, their appetite may have changed. So all the symptoms of a general mental health problem, sleeping changes, being up late at night, these sorts of things can be indicative as well. But also that if they are beginning to seek out or show sort of particular behaviours that suggest that they might be at risk, or some of the things that they're saying also suggest that they could be at risk as well.
Priya Guho is asking a question. What are some of the signs of stress and anxiety to watch out for in teenagers? Not particularly suicidal, but she's just generally asking any stress and anxiety. Have we already covered this?
No, we haven't, I think. I think this is a really, really interesting question. For young people, in particularly young women and girls, eating issues are very prevalent. So I think being mindful of body image and how they may start restricting diet or trying to be quite controlled about how they look can be a sign not just of trying to conform, but also of stress and peer pressure and an anxiety to want to fit in. There can be a huge sense of fear of missing out and fear of not being part of the peer group. And there's that collective pressure on teenagers. So I think it's worthwhile to watch out the sort of friendships they're keeping. Have they changed radically? That can be another good sign if someone has been with a particular crowd of friends since childhood, but then they make some different choices. And also when they get to an age where they might want to try alcohol, or they're being influenced to go out, obviously not quite at the moment, but to parties or gigs and things like this. This can also be a sign where you really have to be careful that they know what they're doing and that they're really sensible to those things that are on offer. Stress and anxiety can also show in terms of their grades. So grades which have previously been really good, they might drop because they're finding it more difficult to concentrate, for example. And sleep can really be affected. And I think teenagers, all of they're wanting to get up quite late, go to bed very late. But I think if they are found sort of up in the night, eating in the middle of the night, etc., these can all be signs that there's problems going on for them and stress related factors.
We did have several questions, and I wish we could go on. It has been such a profound discussion, but we have come to the end part of our show, and time is very limited. Yes, I will quickly go through some of the comments as much as we can cover. You stop me, please, the doctors I'm talking to, and also Jayanta, please stop me if you would like to elaborate on any of the questions. Ananda R.B. Gupta is asking, what triggers panic attack? I think Arghya already mentioned this before. What triggers panic attack?
Yes, so we talked about that. The panic attacks. We didn't really get time to talk about, but it varies a lot from person to person. So sometimes unexpected, sudden arrival of some sort of situation in the society. And it'll be interesting. It doesn't necessarily, need to be a negative event. Sometimes even what is seeming to be a positive event can actually bring that panic attack. It's a response of the mind, and there's some chemical imbalance happens in the brain, mainly involving what we call adrenaline, noradrenaline, those systems. So it can be triggered by a range of events, really. It's difficult to pinpoint, but as I said, most of the time it's a very sudden onset of sudden change, if you like, in their life or at work, sometimes with the unexpected, and also uncertainty about the future. So you can think about any event that really throws this uncertainty about the future that can trigger the panic attack. But yes, it's a wide range.
Yeah.
I'll go to our next question. Shushmita Banerjee asking, Dr. Arghya, do you think hypnosis helps with these types of disorders? Asking because it was recommended in a particular case for such anxiety disorders and panic attacks. Hypnosis.
Right. So hypnosis has got some evidence. I wouldn't say that it doesn't, but it's not something that conventionally we prescribe in psychiatric practice, but we do know that hypnotherapy has got some evidence in mood disorder, but also in some anxiety, particularly in the smoking cessation. I know that it has got a couple of good research articles. But in general, there are other avenues that we often suggest, for example, mindfulness. And in fact, not more recently, the cognitive behavior therapy now is combined with the mindfulness, which is known as mindfulness-based cognitive behavior therapy. So that is well integrated now into the therapeutic side, the talking therapy side. That's very helpful for anxiety disorders and panic attacks. But as I said, hypnosis does help, but the evidence of research is not as strong compared to cognitive behavior therapy.
All right.
Yeah, we have a very interesting question here from Shravanti Dattagupta. Why we hear most of the time mental health issues from middle or upper middle class background? How poor people from developing world can be made aware of the issue? Because sometime I have seen this issue is seen as stigma in some background?
I think that one of the
There's
reasons
stigma
we
in
hear
all
about
backgrounds.
it most.
Yeah.
Absolutely, that's exactly what I was going to say, Jayanta. It's it's universal. It doesn't spare any particular sector of society. I think we hear about it more from particular middle or upper middle class people because those people have the voice. The voice in social media, the voice in journalism. They have the education and the resources to be able to write about it, speak about it, talk about it, and do great things like setting up a foundation, like Jayanta has done, for example. However, I do feel that those from deprived backgrounds are equally at risk. I see a lot of people in the area of London. I work is Camberwell, Southeast London. It's got pockets of extreme deprivation, and the people there have very little in the way of finances. And of course, in other countries as well, this is the case. And they are not, they are also struggling, but perhaps they haven't been able to have a voice about it.
Mm-hmm.
Yeah. And hopefully programs like this will help. So the viewers and listeners, they might reach out to the people who have less awareness. And even 5 out of all the viewers today can do that. I think that will serve the purpose. So yeah.
Paramita Goswami asking Dr. Arghya how to deal with kids' anxiety or fear of unknown. Now, mental health problem in kids and little children itself is a very big topic. Would you like to touch base on this today, or
Uh,
shall we wait another day?
it's a big topic, but in if I could just touch on the principles, because it comes on the remit of child psychiatry, although the principles are very similar. But kids' anxiety can stem from a number of things, from at work, at school, at home situation. Mindfulness is increasingly being used along with talking therapy. A lot of activities, for example, the play therapy. So there are a lot of what I call non-medical or non sort of chemical interventions, if you like. That's a first port of call for managing kids' anxiety, but it's quite a big topic. But yes, it is again, it's manageable condition. There are a range of talking therapies available, including mindfulness, definite behavioral therapy, cognitive therapy, play therapy, as I said. So please go and seek for help. And again, first port of call can be GP to begin with.
Right.
Shamli
I
and
think we're at the end of our show. We do have lots of more questions, but is it okay, Dr. Dotto and Dr. Sarkhel and Jayanta as well, if offline after the event, if any of these questions would like to give some answers, we can actually post them in the thread itself,
Okay.
in the comment thread in this video.
also, if any of our viewers would like to contact you personally after the end of this show, Arghya, you
we have got a website, livingmind.co.uk. Anyone wants for any assessment consultation is info@livingmind.co.uk. Everything is available on the website. So yeah, we'll be happy to help.
Right.
shall we end it today? And
yeah, I was thinking, Jayanta, why don't you sing us another song? Just make the atmosphere a bit lighter again.
Okay. So I'll do another Bangla song. Bit of it's a Kishore Kumar song, bit of a nonsensical song, but hopefully you'll enjoy it. Chingnei tobu nanta shingo, dimnai tobu osho timbo. Chingnei tobu nanta shingo, dimnai tobu osho timbo. Chingnei tobu nanta shingo, dimnai tobu osho timbo. Ae, lagi chaka hamba hamba. Chingnei tobu nanta shingo, ডিম নয় তবু অষ্ট ডিম্ব ঘরে লাগে থাকে ভাবে থাকে হাম্বা হাম্বা টিক 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 তাও ভাই নাকে এক টিক নসি তার পাখার আজ্ঞা নসি গায়ে চুরি 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 ডিম নেই তবু নাম তার সিংহ ডিম নয় তবু অষ্ট ডিম্ব গায়ে লাগে থাকে ভাবে থাকে হাম্বা হাম্বা টিক 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 Bop, 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 bop. দুই পায়ে পরে লাগরা যাও নয় হেঁটে লাগরা জামতলা আমতলা নিমতলা পথে পাবে নয় নয় তো ঠাট্টা খাও পেট ভরে গাট্টা কাঁচকলা কানমলা খাও তুমি কত খাবে কাঁচকলা কানমলা খাও তুমি কত খাবে টক 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 করে টক্কা আর কত দূরে বোগদাদ মক্কা খায় লাগে চাকা দাদা চাকা হাম্বা টিক 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 সেই নাই তবু নাম্বার সিংহ ডিম নয় তবু অষ্ট ডিম্ব খায় লাগে চাকা দাদা চাকা হাম্বা হাম্বা টিক 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 Pop, 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 pop. Bulgal Vishu Nondi, Din Radate Punji, Juri Juri Guri Guri Bora Bora Kata, Bole, Pagarai Bete Borda. খায় পান সাথে জর্দা ফুলবাজি ডিগবাজি রকবাজি শুধু চলে ফুলবাজি ডিগবাজি রকবাজি শুধু চলে এবারের পরিচয় গুরু কুচকে ওবারের কেনা হাসি মুখ মুচকে গায়ে লাগে চাকা ভাবে চাকা হাম্বা হাম্বা টিক টিক সেই নেই তবু নাম তার সিংহ ডিম নয় তবু অষ্ট ডিম্ব গায়ে লাগে চাকা ভাবে চাকা হাম্বা হাম্বা টিক টিক হাম্বা হাম্বা টিক টিক Amba, amba, hey, hippai, uppai, uba, uppai, ingiri, jirakiri, uba, baduba, hey, chukumaku, jingle lagi, hey, chukumaku, jingle lagi, adere, yawo, awo, adere, yawo, doom, tag, hey, doom, tag.
Wonderful. Nice. Well done. Very well done, Jayanta.
Fantastic. Oh.
Thank you so much. And most profound and brilliant discussion it has been. And we couldn't have done it without the such an active engagement from all of you, the viewers. And thank you so much for coming and joining in our discussion today. I must thank you to all the doctors here, Dr. Arghya, Sarkhel, Dr. Rina, Dr. Jayanta, for taking out time from your extremely busy schedule and be here with us. I will also have to thank Dalia. She is also extremely busy these days, and thank you so much for agreeing to join me on this. And I'm very happy to make this happen.
5 o'clock we have another session for Sangeet Foundation celebrating World Happiness Day. So
absolutely.
Do join.
Just hop in from here to there now.
Yeah, just switch from here to there.
We will just switch on. And if you want to listen to more beautiful songs, switch on from here to there, Sangeet Foundation.
No, thank you so much, Dr. Arghya and Rina, Jayanta. Thank you so much for taking your time out and coming to the show. It was a really wonderful discussion.
Yeah.
Thank you.
Thank you.
And I'd like to ask our viewers to please subscribe to our YouTube channel where this entire video will be available so that you can refer to it later at later stage. It will also be there on IBUK page, so you can always come back and hear it. You can share it with your friends and family. And yeah, that's it actually. Thank you so much
for having us.
We hope to meet again soon.
Yeah, sure.
Absolutely.
Thank you so much.
Okay.
Thank you.
Bye-bye.
Bye.
Bye.
Take care.
Bye.
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 Bye.